Neurosurgery is one of the most complex and specialized fields of medicine. As I welcome today's guest, I am reminded of the great masterpiece by Henry Marsh titled Do No Harm. In his book, Marsh describes the high stakes of operating on the brain. He compares it to operating on people's thoughts and feelings and says that one wrong cut could forever destroy a person's character. Now, as molecular biologists, we study the DNA, but the components that make up the double helix are invisible to a naked eye. Astronomers study the stars but never get to touch them. Chemists work on molecules and atomic particles that they can never feel with their fingers. On the other hand, neurosurgery is one field of medicine which dares to improve upon billions of years of evolution in just a matter of a few hours. For a neurosurgeon, the greatest mystery of creation, the human brain, resides in a few pounds of greasy flesh and blood. Now, imagine a combination where a neurosurgeon could use his surgical expertise and scientific training to investigate novel hypotheses regarding how the brain works. What does it take to combine research and clinical practice in neurosurgery? What are some of the unique challenges and opportunities that come with being a neurosurgeon scientist at a large academic medical center? How has new technology impacted the field and helped neurosurgeons to fine-tune their craft? Today, we will engage with these questions and a lot more. Hello everyone and welcome to Doc Talk. Today, I have the pleasure of speaking with a neurosurgeon scientist who has an independently funded lab that does fascinating work on implantable devices that can interact with the nervous system. My guest today, the Assistant Professor of Neurosurgery and the Associate Director at the Center for Neuroengineering and Therapeutics at Penn, Tim Lucas. Dr. Lucas, welcome to the show.
Thank you for having me.
So I think we will just begin by learning about what kind of work your lab does and how did those research interests develop?
Absolutely. So, our lab is coined the Translational Neuromodulation Lab. That name really sums up our spirit. So, we develop implantable and wearable technologies to try to restore neurological functions to individuals who have lost function due to a disease process. Most commonly, that involves things like spinal cord injury, which takes away the communication between the brain and the body, such that you cannot move your muscles, even though your muscles are completely intact. Similarly, we aim to restore sensation to a paralyzed and numb body. The reason we do that is because precise finger movements are quintessential, are very involved and require real time somatosensory feedback. Without real time somatosensory feedback, our fingers and hands feel like a robotic arm, completely numb to us, and we have to use our vision to guide those movements. It's a very clumsy and slow process. We also aim to develop cognitive prosthetics to bridge damaged neural connections that may have been broken as a consequence of traumatic brain injury or penetrating injury, for instance.
So, was there a particular reason that stirred you in this field?
Yes, it is largely the unmet need. So we're at a wonderful time in the history of neuroscience and in the history of human technology. We're at this point where our technological advances and computer processing capabilities, our implantable and biocompatible technologies are enabling experiments and potential therapeutics that were not until recently possible. So we can now address these conditions that have previously been untreated, and patients have a very optimistic outlook, I believe.
That sounds incredible. Now, taking a step back at your career trajectory, you did not go through a traditional MD PhD program. Instead, you did your PhD during your residency in neurosurgery. So, what led to that?
So I've always wanted to help as many people as I could, and I wanted to have a very impactful change in their life, a very impactful or meaningful influence. So as a clinician, you can only help, particularly as a surgeon, you can only help one person at a time in the operating room. So the number of people that you can impact throughout your lifetime is finite. Whereas if you can develop a new science or take the field in a new direction, you can potentially impact many more people than you could ever meet individually. So I wanted to combine those two ambitions. My mentor in undergraduate training was a lovely woman, absolutely brilliant neuroscientist, former MIT faculty member. She was on the admissions committee at our medical school and advised many medical and graduate students. She convinced me, understanding that I wanted to train as a neurosurgeon,
Mm-hmm.
that it would be more important to get my primary and specific scientific training more proximal to the time that I would be looking for faculty jobs. And the reason is because technology advances at such a brisk clip. If I had gained my PhD training while still in medical school,
Mm-hmm.
I would have over a decade before I could apply that knowledge. The field would have totally changed.
Mm-hmm.
So she convinced me to wait, and that's exactly what I did. During residency, I took time out to do the graduate work, to do the dissertation work, such that my papers were just being published right around the time that I was finishing my clinical training, and I had the most up to date skill set as part of my repertoire.
That sounds really interesting. So, what do you think would have been different had you done your PhD while you were getting an MD degree?
Well, I think my skill set would have been different. For me, which is largely an engineering based scientific background, engineering evolves very, very rapidly. In fact, every few months, the technologies have doubled and
Mm-hmm.
quadrupled. And so the field would likely have been entirely different, and I would have had to retrain to get caught up to speed.
I see. Now, I also want to go back to the idea of impact and maximizing that. And having heard your talk a few months ago, I know a lot of it seems to be influenced by the astrophysicist Carl Sagan.
Mm,
How would you leave your mark on this planet?
yes.
So, are there particular philosophies or work ethics that guide you? Because I imagine that hours of a neurosurgeon are really long. So, at the end of the day or in moments when the surgery does not go according to the plan, are there particular philosophies that you sort of rely on?
There are, and Carl Sagan is one of them. The talk that you're referring to, I reference his book, Pale Blue Dot, and I love that book, and I ascribe to that philosophy as well as other philosophies that really have a center point of perspective. So, in all of these philosophies, the central resonant theme is one of taking a step back from yourself and
Mm-hmm.
realizing that there's a larger perspective in the world. That's something that I think we forget as human beings, certainly as surgeon scientists, clinicians. We get caught up in the fishbowl, which is our small world. We are bothered by traffic, or we're upset by writing grants that get triaged, or these sorts of things. But when you take a step back in the first instance and you realize that my whole life's perspective would change if I was diagnosed with a malignant brain cancer tomorrow.
Mm-hmm.
And one day I'm sure I will be. And my perspective and stress will change considerably. And then if I take another step back and I consider where we are along our evolutionary process,
Mm-hmm.
it resets the perspective yet again. And if you step even farther back to the perspective of Carl Sagan, that we're just one small speck in this larger cosmos, it really makes you appreciate that you have to make a very meaningful impact in the very short time that you have on this planet, and you
Mm-hmm.
have to strive very hard to achieve that goal.
Yeah, I completely agree. And I think that's great advice for whoever is listening to this talk. And I think, in addition, there's also another fantastic book written by Frank Wertesek, another neurosurgeon, When the Air Hits Your Brain.
Mm,
And in that book, he talks about how, for a neurosurgeon, the one failure, the one mistake that he commits in the OR
mm,
is a lot more instructive and stays with him for much longer than do 50 saves.
yes.
So, how important is that one failure? And what is the scope or the room for such a failure?
Hmm.
Can a neurosurgeon be not completely confident when he's walking into the OR?
Absolutely. Good question. One of the questions I ask the neurosurgery applicants when they're interviewing for residencies is to give an example of a personal failure that they've had. Not because I want to expose an embarrassing event, but rather I want to see how they dealt with that failure.
Mm-hmm.
Failure, as I explained to them after the line of questioning, is something as a neurosurgeon we have to be very comfortable with. We experience failure both on an epic scale and an epic frequency, meaning almost every day. You'll do the very best technical operation you possibly can, and the patient will still have a complication. You'll completely remove the tumor, and the tumor will regrow eventually and take the
Mm-hmm.
patient's life. You'll write what you consider to be the world's best grant, and it gets unfunded. Or you write the best paper. You spend years working on the data collection, and it doesn't make it into your target journal.
Mm-hmm.
Failure as a neurosurgeon is something that you have to eat for breakfast. You have to have a comfortable place in your soul for failure and
Uh-huh.
realize that failure is just a stepping stone to success. And I go further to explain for them the only thing that differentiates those neurosurgeons who are successful in their
Mm-hmm.
goals and those who are not successful is how they respond to those failures. If you let those failures whittle away at your personality or your confidence, you are destined to repeat those failures.
Mm-hmm.
But if you take them as a learning piece and continue to step forward and march through, you'll be successful.
So I think speaking along the same lines of failure, you also talked about how when you had finished your fellowship training and you were looking for jobs, a lot of the places that you went to, you would express an interest to start a research lab, and they would say, "Yeah, sure, go ahead. You have your two protected days for research, which are Saturday and Sunday."
Yes.
So, what was that experience like? And what are some of the unique challenges that apply to a neurosurgeon scientist when they're considering starting a lab but also keeping up with their clinical practice?
Mhm. There are many competing factors in being a successful surgeon scientist, and particularly being a neurosurgeon. One of them is that it's a technical discipline, just like throwing a ball is a technical discipline or playing a concert piano is a technical discipline.
Mm-hmm.
It requires diligent practice, frequent practice. So it's not something that you can do once or twice per year. You have to do it frequently to maintain your skill set. So being active clinically is important for any neurosurgeon.
Mm-hmm.
Now, that erodes at your time, of course, that you could be spending in the laboratory,
Mm-hmm.
and you want to be active and productive in the laboratory. So, there's a constant battle between time spent on your academic mission, your scholarly pursuits, versus those times that you have in the clinical setting. And so, you have to make those two symbiotic to the greatest extent possible. Look for synergies where you can combine your clinical and
Mm-hmm.
research practice. Many of our projects, for instance, we use data sets that are acquired for clinical purposes
Mm-hmm.
to ask interesting scientific
Mm-hmm.
hypotheses. So we try to use a dual purpose there. But it's a very challenging career, and you're constantly battling these opposing forces.
So, for a student, for anyone, even a resident, any medical trainee who is interested in running a lab or is thinking about neurosurgery, what are some of the questions that they absolutely need to ask themselves to make sure that this field is right for them?
I think the single most important question is to ask yourself, why are you doing this? There are many successful people in the world. There are many people like yourself who are highly intelligent, highly capable, highly motivated. There are many potential successful paths that you could take in your life. So, finding the one that is most meaningful for you is going to provide the fuel for you to stay up all night and to work long hours and to set aside and delay your gratification in other areas of your
Mm-hmm.
life.
So, so is there such a thing as a normal day or a normal week for you? And if so, what does that look like? And in that normal day or week, how do you make time for friends, family, and aside and on top of it, making sure that your work is still as perfect as it can be?
It's very challenging, no question. You have to be very protective of your time. So I am constantly trying to protect my family time and my time with my friends, mostly from mental distractions. So one of the biggest challenges I have is turning off. You have all these missions in your life that you want to be successful for, patients that you care about, and
Mhm.
as we mentioned, many failures.
Mhm.
It's very easy to take those distractions home with you. And so you have to be very good at switching off that part of your brain so that you can be clear and present with your family and your
Mhm.
friends because they love you and they want to spend time with you
Mhm.
and you need them too. So
Right.
that's the most important thing is to be very protective of your mental time when you're away from the lab or you're away from the clinical practice, you need to focus on being present
Mhm.
with those that you love. And when you're back in the lab, you can devote more energy concentrated
Mhm.
into that endeavor.
Well, that's great advice. Thank you so much, Dr. Lucas. So let's wrap up with a set of quick response, rapid fire style questions.
Okay.
So next, I'll be asking you questions to which you will have very little time to think about, and your task is to come up with the first response that comes to your mind.
Okay.
So the first question that I have for you is, during what part of a scientific research process are you the happiest?
Probably when you have a student or someone who you're working with bring a question to you based on the data they've acquired that aligns with a question that you internally have. It makes you feel like you're making a scientific mental connection with someone else.
Mm-hmm.
I care very deeply about my research, and it's nice to see that reflected in someone else as
Mm-hmm.
well. I think that's the most gratifying.
Great. The second question is, what is the one question that neurosurgeons, by the virtue of their training, are uniquely poised to answer?
I think the question of language and internal thought representation is probably the one that we have the most unique value proposition to the scientific community. What I mean by that is you have mental thoughts, I have mental thoughts, and our thoughts, which no one else can hear, we hear in our own voice, even though our vocal cords are not moving. So there's an internal consciousness, a dialogue that you have in your brain all the time. How does that happen and why does that happen? Is a question that neurosurgeons potentially can answer by studying the brain's mechanisms and the electrophysiology,
Mm-hmm.
and we have access to the brain on a regular basis.
Great. So, lastly, if there's one thing you could change about your daily routine, what would that be?
I would allow myself to devote more protected time just for me. So, the biggest problem I face individually is that
Mm-hmm.
I want to be everything for everyone. I want to be 100% involved for my patients. I want to be 100% involved for my students and my lab. I want to be 100% involved for the teachers and the people that I'm teaching. And I want to be 100% involved for my family. So, it's very difficult to meet all of those aims all
Mm-hmm.
the time. The last bit is that the only way I can have energy to devote to all those other people is if I'm rejuvenating myself. And so you have to be willing and uncompromising in protecting some time for yourself. Carve out a little piece of your day where you can either have self reflection or you can train for your physical events, whatever it is that you want to do. But protecting that time is important for the marathon of your life.
Mm-hmm. Well, thank you so much, Dr. Lucas. I think this was fantastic advice. And thanks once again for sharing your stories and your career trajectory. I'm sure a lot of the viewers would benefit tremendously from hearing how you approach life and your career. And as you all saw, there's no one right way to chart your career and leave your mark on this planet, as our guest today puts it. Hopefully, if you want to combine a career that involves scientific research and a surgical opportunity, you have one example here that does that extremely successfully. Thank you all for watching this episode of Doc Talk. I hope the words of our guest today inspired you to strive for a meaningful career in medicine. Don't forget to tune into the next episode where we have another exciting guest lined up to share his journey as a physician scientist. Until then, this is Divyansh Agarwal signing off.